Let's now start off this bulletin by bringing you the recent updates about the coronavirus pandemic in India. Novel coronavirus cases continue to surge in India with more than 390 infections and 7 deaths. Prime Minister Narendra Modi led an effort to stem the surge in COVID-19 cases in the world's second most populous country by calling for a 14-hour people's curfew this Sunday. But the bigger question remains, is India headed for a complete lockdown? The deadly coronavirus has spread to 22 states across India. The centre and various states have decided to completely lock down 75 districts across the country, where coronavirus cases and fatalities have been reported. The districts where lockdowns have been announced include the states of Uttar Pradesh, Maharashtra, Punjab, Karnataka, Tamil Nadu and Kerala, New Delhi among others. On your screens right now is a map that's showing you where coronavirus has spread. 80 districts have been locked down across different states in the country. These are the different districts in different states across the country that are currently under lockdown to curb the coronavirus outbreak as of now. Now, with COVID-19 cases increasing many-fold, the state governments have been given complete jurisdiction to expand and impose restrictions depending on their assessment of the situation. While a lockdown is a severe measure implemented in cases when outbreaks appear to be sliding out of control, let's now talk about what exactly happens in a coronavirus lockdown. In the event of a lockdown, a panic-like situation needs to be avoided at all costs. All the essential services will be operational, so yes, you will have access to pharmacies, hospitals and of course groceries. So avoid hoarding and panic buying at all costs. Many countries like China, Italy and Spain have enforced a complete lockdown. New numbers of infected cases have significantly been controlled in most of these countries. Indians braced for the 14-hour Janata curfew yesterday. Now, a Janata curfew is basically a voluntary curfew, and it is important to note that Sunday's voluntary curfew is now being seen as a pilot for a broader lockdown that can be imposed if the spread of this virus continues unabated. India has a generous lead time in preparing for the COVID-19 outbreak, but it is running out and fast. For a country like India with a large unorganized labour sector, this makes the challenge even greater. With 7 beds per 10,000 of the population compared to the 29 in the US and 34 in Italy, India comparatively has a weaker public healthcare system. To deal with such a challenge, all branches of government, the private sector and civil society at large need to work together.